Up for a while, perhaps, but then you go home
And you sit on the couch and
and
watch
you sit on
TV.
the couch and watch Game of Thrones.
So you would say that a common chronic back problem would be just muscle strain because of sitting down?
Yes, so it starts like a muscle sprain or strain.
Okay.
And with prolonged sitting, it becomes a chronic muscle sprain or strain. But with the stresses of sitting a lot and poor posture, then you get changes in your back like slip discs. Then it becomes something more chronic and permanent, and it can progress and pinch your nerves, and then you start getting more back pain and even pain down the leg.
Okay, we'll come back and talk about treating these common back problems. You've been listening to our spine specialist, Dr. Prem Pillay, on Ask the Expert.
Be lightly active and mobile during the working day. And, we have sit-stand desks now, and I encourage a lot of my executive patients to get these desks which are motorized. And so they spend part of the time sitting and working on a computer or laptop, and part of the time standing and working as well on the computer and laptop.
Okay, so that's what you recommend to treat this kind of back problem.
Well, this is more
Stand out while
preventive
you work.
and, as a precaution to reduce the stresses of sitting and bad posture throughout the office day.
But what if your back is already fried? What if you, like you said, you have a slip disc from years and years of sitting down?
Well, then it depends on the degree of the problem. I know a lot of people will go and do massages and try and treat it in a simple way, and that's okay with a muscle sprain. But I usually tell people, if you've been going 3 or more times and that pain really doesn't go away, there's only temporary relief, then get it checked out. So as a spine specialist, we assess the spine, we look for signs of nerve irritation, and we also do scans including MRIs. So these are beyond x-rays. We can actually look into the spine really clearly, and we can see not just the bones, but the soft parts, which are more important, like the nerves.
So what if there are nerve damages?
Well, if it's a really slight kind of a slip disc and some minor nerve irritation, we can design a combination of light medicines and an active physiotherapy program to improve the health of the spine.
Oh, I see. So not everybody has to go for surgery.
No, not everybody has to go for surgery. There are also a variety of spine injections we do. There are even like laser-like treatments to the disc. These are in the category of discoplasty. These are day procedures to reduce pressure on the nerves, improve the health of the disc, and get people up and doing the things they want to do in terms of sports and other activities.
Okay, one of our Gold 905 listeners, Wei Tai, he dropped me a private message via Facebook, and he's got a question for you. We'll address it in just a bit.
At 57 Mount Pleasant Street. Well, it's the same.
To Dr. Prem Pillay, spine specialist from the Neuro Spine and Pain Center. Dr. Prem, before you go, I've got one more question for you.
Sure.
You have to be honest, okay? Can back pain be cured by simply going to the chiro or the acupuncturist or a sports massage therapist?
Well, if you have an acute back pain, let's say from a sports event or carrying something heavy, and it may just be a muscle sprain or strain, then why not? I think it can be. But our general advice is that if you're having a pain that keeps coming back despite going for therapy and massage of whatever kind, chiropractor, osteopath, tweener, then you need to get it checked out, particularly if you get pain that starts spreading down the leg or the arm from your neck or your back. That could be a nerve.
Have you ever met someone who's maybe advanced in age and didn't get help for his or her back pain? What was the situation like? How bad does it get?
Unfortunately, we do see patients quite regularly who come into the emergency room, some on a stretcher, some on a wheelchair. They've had a really bad attack and they can't move. And some of them, unfortunately, have pretty serious and severe nerve pressure, and they may need surgery.
So how should people prevent back pain?
I think sit less, move around more, get your posture right. Get a good chair if you're working a lot, get an ergonomic chair, and consider getting a sit-stand desk nowadays. They're getting cheaper and cheaper, electronic, motorized systems. They can be anywhere from $500 to $1,000, and that could save your back.
I have to apologize for making you sit down for this interview today.
No worries.
You can stand up now because we're done. Thank you very much, Dr. Prem Pillay.
Thank you.
Once again, we've been speaking to Dr. Prem Pillay, a spine specialist from the Neuro Spine and Pain Center at Mount Elizabeth, right here on Ask the Expert on Gold 905.
The home stretch with Jamie Yo.